The Harris County Institute of Forensic Sciences Toxicology Laboratory is pleased to announce a new testing method for cannabinoids in blood and urine. Beginning in April 2025, you may notice some new analytes listed on a toxicology report. In this presentation, we will discuss the drugs and related substances included in the new cannabinoid testing method. First, let's define what we mean by cannabinoids. Cannabinoids are chemicals found in the cannabis or marijuana plant. There are dozens of cannabinoids. The most famous cannabinoid is delta-9 tetrahydrocannabinol, often just abbreviated as THC. Delta-9 THC is the primary chemical responsible for marijuana's psychoactive effects. The effects of delta-9 THC are varied. It can cause euphoria, heighten sensory perception, relieve pain, stimulate appetite, and reduce nausea. The negative effects include impaired judgment, impaired memory, slow reaction times, and altered coordination. Traditionally, when we discussed delta-9 THC use, we mostly meant smoking marijuana plant material. However, alternative formulations are increasingly popular and include highly concentrated formulations such as hashish, wax, shatter, butter, and vape liquids. Delta-9 THC can also be incorporated into baked goods, gummies, and other edibles intended for oral consumption. There is also a prescription formulation of delta-9 THC called Marinol or dronabinol, which can be used to stimulate appetite in chemotherapy patients. On our report, you will see 3 analytes related to delta-9 THC: 11-hydroxy delta-9 THC, delta-9 THC, and norcarboxy delta-9 THC. Once delta-9 THC enters the body, it is distributed throughout the body and may accumulate in fatty tissues. It also undergoes a process known as metabolism, where the body converts delta-9 THC into other chemicals known as metabolites in an effort to get rid of it. The 2 main metabolites, which are included in our testing method, are 11-hydroxy delta-9 THC and norcarboxy delta-9 THC. 11-hydroxy THC is as psychoactive as delta-9 THC and has a longer duration of effect. It is more prominent after oral consumption of delta-9 THC than after smoking. This explains in part why users have a different drug experience after oral consumption than after smoking. The 11-hydroxy THC is then metabolized into norcarboxy delta-9 THC, which is not active. So what are the other analytes highlighted in yellow that are going to be on our report? These compounds are semi-synthetic cannabinoids in some of their metabolites. But what exactly is a semi-synthetic cannabinoid? Semi-synthetic cannabinoids are chemicals that are derived from hemp. They are intended to produce the same euphoric and relaxing effects of delta-9 THC without having the negative consequences of delta-9 THC use, like failing a urine drug screen for probation or parole or pre-employment drug screens. You can find semi-synthetic cannabinoids at smoke shops or convenience stores in a variety of products, ranging from vape liquids, gummies, edibles, and beverages. However, the manufacture of these products is not regulated, so the labeling on the package shouldn't be trusted in terms of which drug is present and how much is there. And despite being labeled as delta-9 THC free, many of the products do contain delta-9 THC. Additionally, the legality of these products may vary by jurisdiction depending on how the law is written. As of the time of this recording in April 2025, The legal status of other THCs and semi-synthetic cannabinoids are the topics of this legislative session. Concerning for us, particularly in impaired driving, is that some of these semi-synthetic cannabinoids have similar impairment as THC, but they're perceived to be safer. There are a number of semi-synthetic cannabinoids on the market today. Our method will include some of the more prominent ones. Our new test method includes Delta 7 and Delta 8 THC. Delta 8 THC has about 60% of the potency of Delta 9 THC. The potency of Delta 7 THC is not well characterized, but it is thought to have limited or no psychoactivity. Our test method cannot differentiate Delta 8 and Delta 7, so these will be reported as Delta 7/8 THC. We will also test for the metabolites of Delta 8 THC, 11-hydroxy Delta 8 THC, and norcarboxy Delta 8 THC. Like the metabolites of Delta 9 THC, the hydroxy metabolite is active on the brain, while the carboxy metabolite is not. We will also test for Delta 10 THC, which has psychoactivity, but isn't as potent as Delta 9 THC. We will also test for hexahydrocannabinol, also known as HHC, which is chemically similar to Delta 9 THC and is psychoactive. Again, this new testing method is applicable to blood and urine samples collected in medico-legal death investigation cases, driving under the influence cases, and drug-facilitated sexual assaults. The analysis of vapes, edibles, or other dosing units is performed by the Drug Chemistry Laboratory at the Institute of Forensic Sciences. Questions regarding the scope of their testing should be directed to the Drug Chemistry Laboratory. If you have a case involving cannabinoids that is going to trial, or you have questions about the report, feel free to reach out to the analyst and/or the interpretive reviewer of the case. The analyst, who can be found in the far right column in the results section, was the person who performed the testing in the lab and determined whether the substance was present or absent. If you need to discuss the effects of the identified drug on a person, contact the interpretive reviewer, whose signature can be found at the bottom of the report. If you have questions about this new testing method or the toxicology laboratory in general, please contact me, Dr. Teresa Gray, Director of Forensic Toxicology at the Harris County Institute of Forensic Sciences.